Hello.
Hello everyone. Good evening everybody. I am Sanya from Radiance with You YouTube channel. I hope you are keeping safe and healthy. Today we are talking about a
Hello.
very important but often ignored topic, voice disorders. Your voice is one of your strongest tools for communication. But what happens when your voice suddenly becomes weak,
Hello.
strained, or simply refuses to cooperate? Doctor, can you hear me now? So, as we were talking about voice disorders, and disorders occur when the vocal cords don't work properly. This can be due to infections, overuse, acid reflux, stress, or underlying conditions. Many people think voice problems will just go away on their own. But persistent voice changes often need the right care and attention. Don't worry, we are not just here to talk about the problem, we are here to talk about solutions. We'll understand how to prevent voice damage and explore the latest treatment options to maintain healthy vocal cords. So let's connect today with our voice health expert, Dr. Manjunath MK, a highly respected ENT specialist known for his experience in treating voice and throat disorders. Throughout his career, Dr. Manjunath MK has contributed immensely to the field of ENT and voice care. His commitment to advancing diagnosis, treatment, and awareness of vocal cord conditions is evident in his extensive medical work. Dr. Manjunath MK, joining us live from Bangalore, will be guiding us on the topic When Your Voice Fights Back. What is a voice disorder? With years of experience in managing ENT and voice related conditions, he continues to provide trusted and patient focused care to individuals suffering from vocal issues. Doctor, it is truly a pleasure to host you today.
Thank you. Good evening.
Good evening, Doctor. And, Doctor, as we are going to talk about a very important topic that is voice disorder, my very first question to you is that what is basically a voice disorder?
Voice disorders can vary. From small change of voice when you have some cold, cough, to something very severe, like suppose a person is smoking for a long time and then he starts developing changes in voice, so that can be very serious. So it ranges from a small, basic change of voice from cold, cough and cold to cancer. So it can be like hoarseness of voice, like a breathy voice or a squeaky voice, or sometimes some kids, especially the male kids, their voice doesn't change after puberty. Teachers, after speaking for a long duration, feels some, change in their voice, some breathy quality in their voice. Mm, Sometimes they feel some pain while speaking, and some patients after thyroidectomy or after any major surgery in the neck, they start having a change in voice. So these are some of the things that constitute voice disorders. Uh, yeah.
Okay, doctor. And doctor, how common are voice disorders? Is it common to have voice disorders, or some people have voice disorders?
Yeah, it's quite common. It's quite common, especially in singers and teachers, because they use their voice regularly, and they strain their voice. No, rather than sometimes, I mean, we use the term abuse their voice rather than using it. Uh, I mean, mothers who have small kids keep shouting. They also start developing some changes in voice. So, I mean, it's not very rare, but I mean, it's quite common. I mean, all of us must have experience like when you have cold or cough, sometimes our voice gets changed, or after we go for some party or something, we shout in a live concert or in a cricket match. You go there, you shout for your team, and then come back. The next day, your voice is changed. So this is quite common.
Okay.
Yeah.
Right, doctor. And doctor, what are mainly the causes of voice disorder when we have talked about what is basically voice disorder and how
Mm.
common it is? What are the main causes of voice disorder? Are there any specific causes if someone is living in extreme winter condition or
Mm.
cold condition? Is it like that he or she is likely to have voice disorders more? Or as you said that if someone is a singer or a teacher because they are using their voice more. So is it like what are the different various causes of voice disorder in different people?
Yeah. Let me start from something very benign, very smaller thing, like you have a cough or cold, or you go to a concert or a match and then come back uh, with a voice change. This is the commonest one. We call it as acute laryngitis. And I mean, these are usually self-limiting unless you strain your voice more and then damage your voice box or the vocal cords, what we say. Uh, so this is what I mean. The acute laryngitis. If you, I mean, the first thing you need to do in such cases is give some voice rest. You don't. Once you have change in your voice, you don't shout, you don't strain your voice more, so that I mean, it damages further. So the best thing to do at that time is like give some rest. Most of the time, the nature will heal by itself, and your voice gets back to normal within a couple of days. I mean, good hydration, drink plenty of water will also help. I mean, it may not be required to take many medicines at this point of time because it's usually self-limiting. And going to a little more and more complex cases, like I mean, like I said, singers and teachers will develop voice disorders. Usually, it could be because of vocal nodules or polyps. These are small swellings that can arise on the vocal cords. So, I mean, even a small. I mean, the vocal cords should be straight. Even a small change in its architecture, even a small bulge on it, or a small depression can also cause a lot of voice change.
Right. So we are having with us Dr. Manjunath MK, live from Bangalore, and we are talking about the various voice disorders. What are the symptoms of voice disorders? We were talking about the causes of voice disorder, and as doctor already told us that how uh, if someone is a teacher or an artist and they use their voice a lot, so that's why they can have voice disorder. Today we will also be discussing about the voice disorder symptoms, the diagnosis, how we can treat the voice disorders, and are voice disorders preventable, and if the voice disorder cure is really possible or not, and do voice disorders recur. So welcome to Radiance with you. I am Sanya, and we are talking about voice disorders. And we have with us Dr. Manjunath MK, who is an expert ENT doctor from Bangalore, and he is explaining us that how common are the voice disorders, what is basically voice disorder, and how we can prevent ourselves from voice disorders. We are going to discuss more about the recurrence. You can also share your comments and questions in the comment section. We are waiting for your questions as well. We will also be discussing about the treatment of voice disorders. What are the various treatment of voice disorders, and is the treatment is really possible or not, and how voice disorder is a serious disease and how we can definitely not ignore it. And a lot of people usually don't take care of their voices, as doctor already mentioned, that when you go to a concert or a match, you shout a lot, and then the next day your voice is different, or you are in cold weather and in winter. A lot of people have a lot of voice issues. How we can prevent that? How is an ENT specialist like Dr. Manjunath MK important for the patient? Because it is very important to take care of your vocal cords, because everything is about communication. And we have Dr. Manjunath MK with us. Doctor, as we were discussing about the causes of voice disorders, and as you have mentioned that there are so many causes of voice disorders, uh, what are the various symptoms of voice disorders, doctor? Okay, so after that, we will be discussing about the various symptoms of voice disorder. What are the different symptoms of voice disorders, and which patient group is most likely to suffer from voice disorders? As doctor already mentioned, that sometimes people who go out and shout a lot re- regularly develop a voice disorder, and they think their voice will come back, but that does not happen. So we will be discussing about various things, and we will be also discussing about the various questions you already have in the comments. Welcome to the Radiance with You channel. Don't forget to subscribe our channel. We are today talking about the diagnosis, the treatment, and awareness of vocal cord conditions, which is evident in his extensive medical work, because it is important to take care of your voice. So, voice is everything, because communication is everything. If your voice disorders occur when the vocal cords don't work properly, this can be due to infections, overuse, acid reflux, stress, or underlying conditions. We will be, and
Yeah.
doctor, as we were
Sorry.
discussing about
Mm.
voice disorder,
The
and
causes.
as you told
Yes.
us about the causes, what are the various symptoms of voice disorder? How can one can define, that this is a voice disorder and he or she has to go to a specialist? Because people also do self care, they also use over the counter medication. What is your take on that?
Yeah, like I said, as I was telling earlier, the simplest thing is one more acute laryngitis or a small throat infection where you have change in voice. This is usually self-limiting. Do not take over-the-counter medications for that. Just give some voice rest, drink plenty of water. Your voice gets back to normal in a couple of days. If it doesn't, then you have to see a doctor. In 2 days, if it doesn't get back to normal, then you have to see a doctor. But don't strain your voice. So this is what I was telling. Then you have singers. Singers, they can't sing high notes. Their pitch breaks. Their voice breaks when they reach a higher pitch. So this is again one very common thing. Teachers start noticing some pain after they take some 2 or 3 classes. uh, their voice becomes like breathy. So this is again a voice disorder. Like I said, these people usually develop some nodules or polyps or some cyst on their vocal cords. And these people may definitely have to consult a doctor rather than taking some over-the-counter medication. Uh, People who are engaged in speaking in any business, hawkers or businessmen or marketing agents, even they develop a change in their voice. The voice changes. It may not be overtly noticeable to the family members because it changes over a period of time. But somebody who, when you speak on the phone, somebody after a long time, and your friend notices there is your voice changed, then obviously then you have to start seeing a doctor. The most and very important thing is if there is any change in voice that is persistent for 3 weeks, more than 3 weeks, it he or she has to see the doctor. to rule out any cancer or anything like that. Especially if the person is a smoker or there is alcohol abuse, definitely these people needs to go and get their throat evaluated rather than taking some over-the-counter medications. Uh, symptoms, like I said, I mean, it's just a change in voice. Your normal voice changes to something that is abnormal. Or people start, I mean, or on the phone, people start asking you for if you have any cold or something and what happened to your voice. Uh, then, like pain after speaking for longer duration, pitch changes in singers, mm, uh, or even the, after adolescence, the male voice, the boy voice has to change into a male voice. If it doesn't change, if there is persistent of a childish voice, then again they need to see a doctor. Mm, yeah, these are some of the things that needs to be taken care of. Yeah.
Yes, yes, doctor. And doctor, we also have a live viewers question who are watching this live. So before
Mhm.
we move on to the treatment and cure, we have a question that can inadequate sleep affect the voice?
Yes, inadequate sleep, yeah, I mean, not drinking plenty of water can also affect the, and even acidity, acid reflux. This can also uh, cause change in voice because, yeah, like I said, the voice is produced by something known as vocal cords. There are two vocal cords, uh, right and left, and then these have to be perfectly in straight line. Anything, I mean, if there is any swelling of the vocal cords, maybe because of lack of sleep, maybe because of uh, this acid reflux, this causes voice change. Even when you shout, also because of trauma to the vocal cords, they get swollen. Again, there will be some change in voice. So adequate sleep, adequate hydration, that is drinking good amount of water daily, controlling your acid reflux. These are essential to keep your voice healthy.
Yeah,
Yeah.
doctor. And doctor, a lot of people use
Uh,
lukewarm water
you're not
when.
audible to me. Yeah.
Okay, doctor, am I audible now?
I'm sorry, I can't hear you.
Doctor, can I? Am I audible now?
Hello.
Am I audible now? Hello, doctor, am I audible now?
Yeah. There's a question as a teacher, how can I protect my voice? Yeah, very good question because teachers are the ones who develop uh, problems in their voice more frequently than anybody else. Because these are untrained voice professionals, because singers are trained to use their voice. Teachers are not trained to use their voice, but they use their voice a lot. Sometimes even, I mean, more than any one of us. So they tend to develop changes on their vocal cords. So how to keep their voice healthy is like, I mean, drink sips of water in between every 15-20 minutes. You take some sips of water.
Yes, so as doctor was answering your question that how lukewarm water can help you protect your voice, and if you are a singer, artist, or teacher, then you if you have some vocal issues, then how can you protect your voice and how can you actually make your voice good? And as doctor already told us the various symptoms of the voice issues, if someone is having voice issues, he or she should definitely go to an NT expert. If assist if there are changes in the voice, and if someone is telling that the voice has changed, someone has to go to an NT specialist. Don't use the over the counter medications. Doctor, am I audible
Yeah.
now?
Yeah, yeah. Sorry,
Yes,
yes.
no problem,
Yeah,
doctor. As we are discussing about how someone can protect the voice if he or she is a teacher, singer, or
teacher.
speaker.
Yeah. One, like I said, I mean, Every 15-20 minutes, keep sipping some water. Okay. Know your limitation. Do not overexert. Uh, if the class is more than 30 members, better to use a microphone rather than trying to speak out to a larger audience. Uh, and when you're speaking, when you're taking classes, I mean, it's better to come near the students and speak in a comfortable voice, comfortable loudness, rather than trying to shout, standing near the blackboard. I mean, which itself will give some distance between the first row and the and yourself. So you have to. There's a certain amount of gap that needs to be filled up. So you obviously will start speaking in a louder voice. So it's come closer to the students, speak in a comfortable voice. Um, yeah, and there should be a break in between two classes. Like I said, the hydration is very important. And if there is any change, see a doctor.
Right. So these are the various things someone can do to protect their voices. Doctor, there is a question that should I make a dietary changes for a better voice? What is your take on that? If someone have a diet planned, or if someone is eating oil, or because it is a myth, like, if you eat more
Mm.
oil, your voice is likely to get affected, or if you eat ice cream. So are there any dietary changes someone should make for a better voice?
Yeah, like I said, the one thing that causes one of the thing that causes a change in a voice is acid reflux. So you need to avoid things that can cause acid reflux, like too much of citrus fruits, too much of spicy food and oily food. Mm, too much chocolates, Coke or any carbonated drinks, cigarettes, alcohol. So these are things that causes acid reflux, and since the food pipe is just behind the voice box, so if there is any reflex of the acid, just falls on the vocal cords, and the vocal cords get swollen up. So that causes change in your voice. And if you already have some lesion like nodules or polyps, they tend to get aggravated. So it's always better to control your acid reflux. So these are some of the food changes. I mean, otherwise, yeah, I mean, this like chocolates. I repeat, chocolate, carbonated drinks, citrus, caffeine, too much of coffee and tea, uh, then there's alcohol, all these things. Better to avoid.
Okay. Yes, yes, doctor. So these are all the things which you should not eat or drink because
Yeah.
of
I mean, of
the
course.
voice
Uh,
changes.
I mean, it should not be when. I mean, I can't ask everybody to stop drinking coffee or tea, but it should be in moderation rather than taking too much. Like not a 5, 6 cups a day. 1 or 2 cups is fine.
Yes, 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 doctor. And doctor, as we have discussed about the causes, the symptoms, and what are the voice disorders, are voice disorders, how they are diagnosed, how someone can define, and he or she has to go to ANT, and what are the various treatment which are available for voice disorders?
Yeah. Uh, Earlier, we used to examine the. I mean, voice is produced by voice box, which obviously is not uh, directly seen, unless like your nose or throat or ears. It is somewhat hidden lower down. So you need something to examine your voice box. Earlier, we used to do something like a mirror examination, but nowadays we all have endoscopes. Yeah, so we put a small endoscope either through your nose or through your mouth, and then there is a camera connected to it, and it comes out on the camera. So you can see you yourself can see what's your voice box, and we look at those the changes in the voice box, and there is an advanced examination called stroboscopy as well. This shows vocal cord movements, vocal cord vibrations on a slow motion. So that will give us more better picture than the simple laryngoscopy or the endoscopy. So these are some of the things. This is the most basic thing required to examine your voice disorder. Uh, can I have your second question, the second part of the question, please?
Yes, yes, doctor. It was about the treatment of voice disorder,
Yeah.
how the voice disorders are treated.
Okay. So it depends on what kind of voice disorder you have. Uh, if it is like habitual, or if it is because of the voice overuse or abuse, just like in teachers, it could range from simple voice therapy. Or voice therapy is something like a training exercise given by speech language pathologist. If I put it in a simple analogy, it's like for bones and muscles, you have physiotherapy. For voice, you have voice therapy. It's I mean, a simple analogy to compare. Uh, so, I mean, that can cure some of the voice disorders, especially when it happens because of a abuse or overuse. Some of the things like polyps or cysts may have to be removed surgically. So I mean, there's a simple surgeries done through your mouth itself. There's no external cut or anything like that. Uh, I mean, there are some changes. I mean, like the simple things, acute laryngitis, I've told you earlier, these are self-limiting. They can be treated with some medications. The, the first thing you have to do when you have a voice change is uh, give some voice rest, 1 or 2 days, couple of days rest, and drink plenty of water, have good sleep, control your diet, and this itself will cure most of the simple things. If it persists, obviously you have to get yourself evaluated with a doctor, an ENT surgeon. Uh, and there could be some more sinister things like cancers of the vocal cords. Vocal cord cancer, when shown early, have a very good prognosis. I mean, it can be almost completely cured, as you can say. Like the treatment is also not very complex. A simple surgery to the mouth, at daycare surgery. Morning you come and get to the hospital, and evening you go back after the surgery. Is all the cure for a simple cancer of the vocal cords. Then this can happen only if you are cautious and you show it to your doctor at the earliest. Like I said earlier, any voice change, any change in a voice that persists for 3 weeks needs to be examined by an ENT surgeon by means of endoscope. So, I mean, yeah, if, it could be benign lesions that can be treated, even if it is uh, this thing like cancer, it can be treated as well. And yeah, I mean, voice change after you can. Some people might notice voice change after thyroidectomy. So after or any other neck surgery, this can be treated by something known as a simple injection laryngoplasty or a voice therapy. Or if it has been long enough, we do something known as thyroplasty. Uh, Thyroplasty can change many voices. Like it can change a breathy voice into a good one, like after thyroidectomy, or it can change from masculine to feminine voice, or we can change a feminine voice into masculine voice. Mm. So these are things that can be treated. These are some of the surgeries or some of the medication or some of the training programs that can be used to treat voice disorders. It all depends on what diagnosis we get on seeing the vocal cords. Yeah.
Okay, very well explained, doctor, that how the vocal cords treatment is available and how someone should not self-medicate themselves. If they have any problem, they should go to a specialist. Doctor, we have a live viewers questions asking that when should I stop home remedies and seek medical care?
Yeah. Like I said, your voice has to come back to normal after throat infection or after shouting within 2 days. 2 or at the most 3 days. If it doesn't get better within 72 hours, then it's better to get your voice evaluated. And like I said, the most important thing is any voice change that persists for 3 weeks. I keep repeating this because this is very important, because if somebody is having any major issue, that can be solved with simple things. So any voice change persisting for 3 weeks, go to your doctor, get yourself examined to an endoscope. And simple voice problems, 3 days, you can do home remedies. But if it doesn't get better within 2 or 3 days, better to see a doctor, ENT doctor.
Okay, so that means 3 weeks is 3 weeks. You see, wait and take medicines if you think that it is working, and if you think your voice is not getting back, someone should refer to a doctor.
Yes. Yeah. 3 days. Uh, I mean, you can self-medicate. Self-medicate in a sense, not the medications as such, home remedies. After 3 days, you see, I mean, it could be sometimes a general physician or somebody. Uh, they are treating it, and you still feel that your voice is not getting improved in 3 weeks. After 3 weeks, we have to put an endoscope and examine the voice box.
Okay, doctor. And doctor, there's a question that can I do humming or breathing exercise at home for making the vocal cords much better?
Yeah, this is recommended mainly for singers, especially, I mean, when they have performances, when they are training. It's like a warm-up exercises. I mean, you must have seen in the Olympics and all. I mean, you don't you can, come into the field and start running a 100-meter sprint. uh, you might be have seen that they do some warm-up exercises before starting a 100-meter sprint. Same way, when before singing or before training, it's always better to warm up. These are like humming, lip trills, tongue trills. All those things will help sooten your voice box. I mean, uh, to get your vocal cords ready for a bigger game.
Right, right, doctor. So if you are a singer and if you are in that particular profession that you have to speak, you can do various exercises as well as
Yeah.
doctor explained it very well. Doctor, we have talked about the various treatment, the symptoms, what are the causes of voice disorder. Is it like that the if someone is having a voice disorder in the first half of the year and it can reoccur in some years? So do voice disorders reoccur at a particular time, or it can be completely cured?
Uh, Yeah, I mean, there can be uh, seasonal variations, or I mean, it all depends on it's because usually it's related to the your allergy or something like that. So if you have allergy, nose allergy, and then that can, I mean, that can affect your voice as well. So those are the things that can be seasonal. Uh, but nevertheless, I mean, these things have to be evaluated with uh, your doctor. Sometimes, I mean, this can, again, I mean, the other things also can recur, excuse me, the vocal nodules or polyps, they can come back. I mean, after it gets treated with the voice therapy or medication, if you again go for vocal abuse or overuse, again you have start having a voice problem. The simple analogy is like this: like, I mean, you have a wound, you go to your doctor, get your wound treated, you put some ointments or dressings, the wound heals. It doesn't guarantee that if you fall again, there won't be a wound, right? So it's like that. I mean, uh, once you're once you're treated for something, I mean that the cause for the cause for that also has to be treated or taken care of. Otherwise, it keeps recurring. Like if you keep falling, you keep having injuries. Yeah.
Right, right, doctor. If you're not taking care once, and you are doing the same thing again and again, it can reoccur. If some, as you have mentioned, that some people should not use alcohol or drink more of coffee, and more of everything is bad for the
Yes.
health. And if someone is doing it again and again, that means the vocal cord can be get affected.
Yeah. Yeah, I mean, if they keep smoking, if they keep, drinking too much of coffee, there will be reflex. I mean, you treat the reflex, they'll go back with your better voice, and then you start having coffee like every hour or so, and then or you keep smoking. The voice, I mean, the vocal cords are again they have this injury, and then you come back again with the same problems. So it's you have to treat the cause rather than just the symptom.
Right, doctor. So to treat the cause rather than the symptom. And doctor, what is your message to the people who take the medicines in, like, do not take the full course, take the medicine 3 days, and then they left the medicine because they think my voice is clear. So if the proper course of that particular treatment is compulsory or not, because a lot of people do this, that they take over the counter medication, or if they go to a specialist they take medicine for 2 to 3 days and do not do the full course because they think the voice is back again. So are these people have more likely to have vocal cords again?
Uh, yeah, I mean, it's more so with the antibiotics, especially if you take, I mean, I mean, we generally we would have given for 5 days, 7 days. You just take it for 1 or 2 days, and then you stop using the antibiotics. You start having antibiotic resistance in the long run, so that can create a lot of problems. I mean, uh, the other things also, like I mean, sometimes the anti-reflex medication or any other voice. I mean, it's not just is strictly for the voice. It can be generalized to any medical condition as such. So when the doctor is given for a specific period of time, he would have given for specific reasons. So it's better to use it for a complete course rather than you taking a decision of cutting it short. So I mean, this can obviously there will be some partial improvement, and again you can have recurrence of the symptoms, and which may or may not I mean get better with the same medication. You might have developed some resistance for the antibiotic or something like that. So it's always better to complete the course, and after completion you have a follow-up with your doctor. Make sure your vocal cords are completely healed. I mean, these are the things that needs to be taken care of.
Yes, 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 doctor. And doctor, which patient group is most likely to suffer from voice disorders? It is like that, some like from children to like the elder people. Is it like any patient group which is most likely to suffer from voice disorders?
Yeah, some kids who are very naughty at school, keep shouting, those kids, they can develop voice disorders, but most of things, this is self-limiting and they usually get better as they age. The most vulnerable group are the teachers and singers. These are the people who develop voice disorder more often than the general population. And the extreme group is the smokers. And if they develop voice change, they obviously have to get their vocal cords checked. Yeah.
Yes, yes, doctor. So, and also the profession these people are, they need to get regular voice disorder checkups as well, voice checkup as well. If they think that this month they have shouted a lot, or if the voice has changed, because likely their voice has to be changed. So they have to need take the proper follow up from the doctor.
Uh, I mean, if they don't have voice problem, and all teachers or all singers need not come and get their voice evaluation done. But if they have developed some voice change, it's always better to come and get their evaluation. And once they're treated for it, once the treatment schedule is completed, they should go back, see the doctor, and make sure the lesion is completely healed. And also, the most important thing is to identify the cause for their problem and treat that this thing, the cause itself, rather than just the symptoms. Uh, yeah, I mean, so I mean, there's no.
So treating.
Yeah, yeah. Go ahead.
Yes, yes, doctor, please.
Yeah, I mean, treat the cause rather than just the symptom.
Right. So
Yes,
treating the symptoms rather than treating the cause is
cause.
an
Mm.
important thing rather than the symptoms.
Yeah, yeah.
Right,
Treating the
right, doctor.
cause.
And yes, yes, doctor, please.
Yeah, go ahead.
Yes, doctor. You were saying.
No, that's not. Treating the cause is more important. so as to prevent recurrence. And smoking is one of the most hardest thing. I mean, dangerous thing to do. So it has people have to quit smoking in order to keep their vocal cords healthy, or I mean, in general, their body healthy.
Absolutely right, doctor. So, smoking already has, I think, the smoking kills, and it has a different effect on the voice as well and the overall health. So, make sure that you quit smoking. And, doctor, before we have talked about the causes, the symptoms, the treatment, and how various things affect the vocal cords. Any myth do you think is related to vocal cords, and you would like to clear that myth through this session?
Mm, yeah, I mean, there's so many myths like eating ice cream will change my voice, or eating, yeah, drinking cold water will change the voice. Uh, Drinking warm water will get back my voice. All these are actually myth. I mean, they don't have much of scientific evidence. You can have, of course, you can have change of voice after you eat ice cream sometimes, but it's usually because of some throat infection rather than the ice cream itself. You don't blame it on the ice cream itself. It's just your body. Uh, if you're vulnerable, if you're getting an infection because of this, or if you're allergic to, then your throat gets infected, and that infection can uh, possibly spread into the vocal cords, and then you can have infection. But it's not like you have to this thing. I mean, quit eating ice cream at all. Yeah, and drinking warm water. I mean, I mean, will keep your voice healthy. That is also. I mean, it's not a scientifically proven one. Okay, drinking water is more important than the temperature of the water itself. So drink plenty of water, especially when you're talking a lot, especially for singers and teachers. Keep sipping some water every now and then. So this will keep your vocal cords hydrated and moist, and this will prevent damage to the vocal cords.
Right, right, doctor. So don't blame it on the ice cream and the various things you are having. And doctor, it was so insightful session today. We have talked about the causes, symptoms, and various myths about the vocal cords. Before we end this session, any takeaway message for all our viewers watching this live?
Yeah. One, know your limitations of your body. Do not overdo, do not overstretch your voice. Uh, do not self medicate. Just give some voice rest, drinking plenty of water. You will get back to your voice one a day or two. If not, seek medical help. Uh, and if you quit smoking, because that can cause, I mean, more damage to, I mean, all the parts of the body, not just the vocal cords or voice. And if there is any change in voice, persisting change of voice for more than 3 weeks, you get your vocal cords evaluated by an endoscope. So these are three or four the most important things I would like to tell. Yeah.
Yes. Thank you. Thank you so much, doctor. It was a very
Thank
insightful session, and thank you so much for your valuable time. And it has been a very informative session for our viewers, and
Thanks.
truly enlightening to hear your expert guidance. And we really look forward to many more such sessions in the coming days for our audience as well.
Thank you. Thanks so much.
Thank you. Thank you so much, Doctor. And issued in public interest by the makers of Liver Lotion Advanced Genix, a division of Hetero Healthcare. Thank you, viewers, for joining today's session. Stay connected with our channel and do not forget to subscribe to Radiance with You. Thank you. Have a good day.
Thanks.